Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates. Much has been said both nationally and internationally about the Kerala model. How has this state managed to contain the pandemic and the outbreak so successfully? And with the return of people not just from across India but also from the Gulf area, will that record hold and stay? Well, we are here on the ground at the government hospital in Thalassery, and we're going to talk to the key doctors here to try and get a sense of what they're doing differently here. Now, before I come to the doctors, right behind me you can see this is the area where a recent death has occurred, and the primary contacts of the lady who died, to your left if the camera moves, to the left if your camera moves, you can see all of the people. Those are the people who were the primary contacts of a recent death that took place because of the coronavirus. And this sort of aggressive contact tracing and surveillance has been a big part of the Kerala success. Now we'll move here, and I'll ask the camera to move here, and we'll meet the key doctors here, starting with Dr. Namudripad, who is of course heading the hospital here. So what is the overall situation? The world is talking about the Kerala model. Obviously many things are happening here which are different, but in terms of medically at a hospital, I guess some of the precautions are the same. What concerns you the most at this moment?
Now we are happy that we are in a position to control the entire situation in Kerala. But we are having some increase now because of some of the people from our land outside Kerala, as well as from people who are settled in Gulf. They are coming here. Some increase. I hope that we can control it.
Are you worried about a spike as these people come back home? Because we're not talking about a small number. I mean, we have, we have hundreds of thousands of people who could be coming back from the Gulf to Kerala.
Yeah, if they are coming and strictly the government is trying to quarantine them in the house, room quarantine. So people are well conscious. Unlike other parts of our state, we are well conscious about that. People are conscious. Village level, even village level, people are conscious about it, and they are controlling. And
so a high level of awareness.
Yeah, high level of awareness.
So give us a sense, Doctor, what's happening here. We can see if the camera just turns around once again. As we were mentioning, there has been a recent death in the area, and you have got all the primary contacts of that lady who died here. So this kind of aggressive contact tracing, if you can talk a little bit about that.
Yeah, the main point in our success till the date is we are properly identifying the risk population. We are able to properly isolate them, and we are also testing them properly at the early phase. That's the keystone till now, with which we were able to contain till the moment. But the numbers are now increasing because the high inflow from the outside country. So
how are you going to handle this inflow? And do you encourage people, Dr. Namudripad, to come to hospitals, or do you encourage them to stay at home? What is better? Because in some ways hospitals are also a source of infection. You've seen that. Your staff, like all other frontline warriors, are also testing positive.
And what I'm thinking is that if they are having any symptoms, better to isolate and be in the hospital. Without symptoms, I hope that we can ask them for a home quarantine. If there is any symptoms to develop, immediately attend the hospital.
In terms of treatment, everybody is trying experimental treatment right now because we don't have a vaccine. What are you doing on the ground?
We are giving tablets, hydroxychloroquine, then antibiotics, then some antiviral tablets, supportive measures that we are giving. If there are any symptoms, that we are treating symptomatic treatment also we are giving. And I hope that we can, in the future, we'll have vaccines and all, it will be coming.
And a good question to ask, of course, is also how does one keep the health workers safe? PPE, of course, is a must. All of you are wearing face shields here. What about mortuary workers? What about handling of bodies?
actually we are provided with the adequate number of N95 masks. Government is supplying, even MP fund, MLA fund, they are all supporting with the protective equipments like PPE. Even the NGOs are supplying PPEs here. So the personal protection is very much adequate. Mortuary, now we are screening the dead bodies for the COVID management, COVID testing, and if they are found to be negative, we are going with the routine procedures like if needed autopsy, otherwise we will be sending them back If it's found, till now no dead body is found to be positive. If found to be positive, we had to decide.
Now, Dr. Namboodiripad, I want to ask you one thing. In other cities, I have seen examples of false negatives. Sometimes we have found, Dr. Namboodiripad, that only after the test, after the death of someone, on a third test, somebody will test positive.
We are testing even it is two negatives. We are actually discharging them. But if there is any symptoms persisting, there will be third for that we'll try.
Any other thoughts you?
One more I am telling.
Yes.
Sir, in our setup,
Yes.
our success, this one especially in this area,
Come, sir.
we are 1.2 elaborate, and
Yes.
my MLA.
Yes.
And the sub-collector of this area, MLA, Honorable A.N. Shamsir MLA,
Yes.
that for the past 60 days, he is convening a meeting early in the morning. And he is dealing with the different types of doctors of IMA, and then neighboring doctor superintendent, our hospital superintendent, our team members. Every day he is analyzing entire problems of the constituency. And along with the revenue chief sub-collector, then he is analyzing every day that what is possible from our side. He is making it success. So it is a success story of this area, and I appreciate that quality. He is enforcing what the medical people, what the advice it is like.
So the system is working. If I had to ask you to define the Kerala model, this has become a phrase now in the country, the Kerala model. If I had to ask you to describe it in one line, what would your definition be?
It is actually a model throughout the world. Kerala model is a model, and it's a model of success. But I hope that we can continue like that.
What keeps you awake at night? I ask all doctors.
Awareness of the people, and the public are participating. People are believing in the mode of operandi of the government.
What worries you right now?
See, nowadays it is a little bit increase. When it is increasing, and moreover, if you are taking entire India, different parts of the state, people are getting worried. That is also part of our worry.
Of course. Well, thank you, doctors, both of you. Just want to show, if you can come here and just show, Kerala is really taking no chances. It may have a record low number of fatalities, low number of cases, but they're preparing for everything. And if you see this booth here, doctor, while we have cameras on the booth, you can just explain. This is a standby, you're not using it yet. What is this booth for?
Actually, this booth is sample collection booth. If the number is increasing beyond control, we will be using this for testing.
So the doctors will be inside this booth?
Yeah, doctor will be standing inside the booth, and the patient will be standing outside, and throat swab will be collected from there.
So taking no chances really.
Yeah.
So this is it, and even when we were entering Kerala, we found amongst the most efficient, most elaborate, most intricate checks, and at every district we are seeing that. We have another doctor here, ma'am. Yes, ma'am, how would you say that you would describe the overall situation now that an inflow of new people are coming back home? Are you worried about new challenges as people come back from the Gulf and people come back from other parts of the country?
We will overcome everything very nicely. We will hope that all are.
Are you worried?
Don't worry.
Don't worry. Okay, don't worry, they say, but at the same time being extremely careful, taking no chances at all.
We are having different. We are having doctors, and one doctor is the nodal officer. Is a senior most doctor. He's a physician. He's Dr. Ajit. He is managing this COVID scenario. Then like that. Then we are having our psychiatrist.
Yes.
Then we are having orthopedic surgeon. We are having different specialty doctors. Everybody, they are treating it as their own, and our staff, entire staff. They are all conscious. Our nursing staff, grade 1, everybody.
So great.
We are ready for a war.
Ready for a war.
Yeah,
Okay.
yeah. Ready for a war.
So we are ready for a war, say the doctors here. We will overcome, even with the fewest cases in the country and a global record of sort. Kerala taking absolutely no chances, and you can see the attention to detail here on the ground as we report from the government hospital in Thalassery.